the last presentation is about how to communicate the findings from your systematic review. And just to put us in perspective of what we're talking about here, and we'll do this as an example as well, the results from the review, you will have come up with a risk ratio or a mean difference or whatever point estimate at the end, and you'll have this number. You can, we always recommend that you convert it to something that's easy for people to understand, which would be for example, in this case, we're comparing the number of people who had a vaccine or didn't have a vaccine and had pneumonia. And we found this risk ratio and we converted it to what it would mean out of 100 people. So out of 100 people, we would see that we would have one less person who would have pneumonia if they were taking the vaccine. And that would be your estimate. But that's only part one. The second part is about assessing the grade of the evidence. And you would have gone through risk of bias, inconsistency, indirectness, imprecision due to events, and no concern with publication bias. And you may have ended up with low certainty evidence in that effect. And so you have two parts to your conclusion. And you basically could write this as you have low certainty evidence in your risk ratio, which means that there was one less person out of 100, ranging from 3 fewer to 2 more when receiving the vaccine. So you have this number, and you have two parts to it. There's the low certainty evidence, and you have the risk ratio. And you could communicate the results of your review this way. But we know that people were trying to write this in a nicer way or an easier to understand way in their conclusions, or when communicating to consumers in the plain language summary and in your discussion. And we saw that people were using narrative ways to describe their results. And we had seen a lot of not so good examples. So someone might have written, there was evidence for an outcome, this outcome X, which shows at best a non-statistically significant trend in favor of the treatment. So not too understandable, a bit confusing. People would start talking about associations when they're doing a review of cause and effect. And so start using that something was associated with an outcome. Or they would use the classic statements around no evidence of effect, but we do know from the Cochrane Handbook that a lot of people are using no evidence of effect or evidence of no effect in different ways and often confusing ways. And something that probably isn't so good is they might say a treatment reduces mortality when in fact the evidence on which it is based is low certainty. So should we really be so strong when we're communicating those results? Because of all these different ways of trying to communicate them, there was work done about how to communicate the results based on using a grade framework. And basically the system comes out to where you think about two things. You think about your certainty in the evidence, and you also think about the size of the effect that you found from the results. And you can come up with the results statements based on whatever your certainty and effect size is from your systematic review. And so we came up with this large grid of possible ways of communicating the results. And I'll go through them in a little bit of detail. But I first wanted to mention that, it's broken up. So you think about how certain you are in the evidence, moderate certainty, low certainty, and very low certainty. And then again, you're thinking about the size of the effect. So just a tiny bit of background about how we developed these statements. It really began quite a while ago, even back in 2003. There were groups that were working on different ways of communicating the evidence. In particular, Claire Glenton and her group in Norway. We were working on it with the musculoskeletal group as well. trying to think of ways to describe the results in plain language summaries specifically for consumers. And we did focus groups in 34 consumers in a number of countries. And we also conducted a randomized control trial, which helped to further confirm what statements we should be using. So we had this proposed list of statements. There were just 4 statements, and it depended on, again, the certainty of the evidence. And you would go from will, probably, may, or uncertain, depending on the certainty of the evidence. And then you would also add in the word slightly if you actually found a small effect. Unfortunately, over that time period, we started hearing from people that these statements could be quite monotonous. So every time you used it, you used the same statement, and that people wanted more options. And some people were not comfortable with the words that were being used, so they wanted to have some other words, other options again. So we revised the list of statements, coming up with some other wording options. We conducted workshops during our grade meetings, getting feedback from epidemiologists, guideline developers, and systematic reviewers, and then conducted a survey of all the different possible wordings and options that we had in informed users. And that's how we came up with this larger list of options to use. So I'll just go through them in a little bit of detail. So if you do start out with high certainty evidence, many of the phrases that come out of that, no matter what the size of the effect that you found, whatever your risk ratio was, it's a very directed, it results in, it reduces. So it's a very direct, there are no qualifying words because this is what will happen if you do this intervention. When we have moderate certainty evidence, the keywords that we use is that the intervention likely results or probably results in. And again, it's the same wording, qualifying words, depending on the size of the effect. When you have low certainty evidence, the qualifying word is, this intervention may result in, or the evidence suggests. So those are the 2 words that you would use if you're doing low certainty evidence. And then when you have very low certainty evidence, the words that we're suggesting are the evidence is very uncertain, or it may reduce or have little effect on. So the certainty is, but the evidence is very uncertain. So trying to communicate sometimes a direction of effect, and sometimes just saying, we're just very uncertain. And then the words that we use to represent the size of the effect, if it's a large effect, just as Gord was talking about the different thresholds, if you see that it's a large effect, you would say that it results in a large reduction. Moderate, we have no qualifying words for that. And for small, we would say that it slightly reduces or slightly increases. And then if it's really on that point of there's being trivial or no effect, we would say there's little to no difference. And a little bit contentious, you might say that it does not have an effect at all, whether it's a reduction or increase. So those are the words that are pertain to the size of the effect. And again, you would qualify the certainty of evidence using those words such as may, probably, likely, evidence suggests, etc. So that's the basic idea behind the setup. So if I was to go back to the original example that we had, around the vaccines and preventing pneumonia, we would have low certainty evidence for our risk ratio, and we have our estimate is that there would be 1 less person. We would focus on the part of the grid, the statements that are focused on low certainty evidence. So I have that on the right-hand side. We would then have to determine whether the 1 less person, that difference, is actually a trivial effect, a small effect, a moderate effect, or a large effect. And as Gord said, you would come up with your thresholds of what you think would be the size of the effect. And if you decided that a difference of 5 people was your cutoff for trivial and small, then basically this 1 less person is falling in that area of a trivial effect. And then you would go with that and decide, okay, based on that, I have 4 options of how I can communicate the evidence. And I might say that vaccines may result in little to no difference in pneumonia. So it's basically just following a grid. But the main idea behind this was that you would be able to communicate your findings in your systematic review. You could do it in the conclusions, the abstracts, the results, the discussion, and the plain language summary. You may, if you're working with guideline developers, this is how you would summarize the evidence for the developers. You would also, when you're creating summaries, such as plain language summaries for patients, you could use it, policymakers and clinicians. We find that, it's not an unsophisticated way of communicating evidence, and that all stakeholders appreciate the clarity. And that the intervention, this is what I explained for intervention reviews, but as Romina said, they're working on this for network meta-analyses. We have work with prognosis, test accuracy, and also reviews of qualitative research being led by Claire Glenton with the CIRQUAL. So we are thinking of different ways of communicating these for many types of reviews. And then as just to note that, there's some way, there's available in the Grade Pro to be able to come up with these statements. It's somewhat automated because we do realize that you do need to think about the size of the effect, the certainty of the evidence, but it does require some thought because you do need to decide whether it's a small effect, the size of the effect, etc. So just in summary, some key points. Before you can even use these statements, you need to assess the certainty of evidence. That's part one. You need to decide on the size of the effect, part two, and the point estimate. And in doing that, on the size of the effect, you do need to consider what your thresholds and cutoffs are for a small, moderate, trivial, large effect. And you can't do one without the other. In order to assess in precision, you have to come up with your thresholds. In order to communicate the results, you have to be clear about what your threshold is. Use the grid to determine your statement and write your, hopefully we're hoping, informative conclusions. And that's all I had to say. Thank you.
Thank you, Nancy. We've got a couple of questions coming in. Please, we've got a few more minutes left. I know it's the end of a sort of 90-minute session, but do keep any questions coming in for Nancy. One Nancy here from Stavros. MIDs are usually decided on the basis of systematic reviews of qualitative evidence, focus group surveys, etc. These resources are usually not available to systematic review authors outside a guideline development framework. How can individual groups of systematic review authors decide on MIDs and formulate statements accordingly?
So a couple of points. If there is research on the MIDs, that is actually being pulled together in a large database right now that Gord Guide and Tahir Dudji are working on. So we are trying to pull it together, a lot of the research that's available so that people could search. So if you are looking at quality of life, there'll be a database where you could look up, these are the thresholds for minimally important differences. But that's not always available, and it does need to be a discussion with your systematic review team about where you're going to put those cutoffs. And if you happen to be working with a guideline development team, then you would also consult with your representative. Hopefully, your systematic review team would include also people who are key stakeholders, such as consumers and patients. So I think that there are many places you can try and obtain this information, and if that information is not available, then you will need to make some decisions, just as you do, just as people have done previously when they made conclusions, but not being transparent about it.
Thanks, Nancy. A question from Stefan. How would you formulate a summary statement when the 95% confidence interval lies between the MIDs for harm and benefit, thus indicating true equivalence?
I guess, could we clarify that question?
Sure.
If the MID, if the point estimate lies between
the
I guess the key, sure, I guess the key point is that your statements, whether you choose a large effect, a moderate effect, a small effect, or a trivial important effect, that depends on the point, where the point estimate is. So it's not about the confidence intervals or anything, it's about where the point estimate is. the confidence intervals would have come into play when you were assessing your certainty of the evidence. So once, if we go back to even this one, wherever it lies, you need to think about that point estimate, that one, and where that point estimate is, not what the confidence intervals are.
So
when you're
just
deciding.
to pitch in here, in the situation that was described, if I understand it, you would be rating your certainty in a trivial or no or trivial effect. In other words, the point estimate lies between trivial and a small MID for benefit, MID for harm. You'll be rating your certainty in a trivial or no effect.
Yes, because you're focusing on the point estimate, and the confidence intervals determines your certainty of evidence.
Thank you.
Okay.
Thank you both. Another question here from Gregorius. This for you, Nancy, I think. How can we describe narratively results in the results section for secondary outcomes which we do not have assessments of certainty of evidence? We have done so only for the 7 most important outcomes.
Yes, I mean, you really would need to have some assessment of certainty of evidence to be able to communicate those. It wouldn't work, actually. You need to have a grade assessment.
Okay, thank you.
And it could, and actually we're saying it doesn't even need to necessarily be grade. If there's another system that you're using that has 4 levels, you could apply the same idea.
Thanks, Nancy. And just one that's coming in through social media as well on translation. The statements are developed in English. Have you considered how these could be translated into other languages? Sorry, go ahead.
So actually you'll notice that we did do the original work in Canada, Norway, Australia, Argentina. So we do have translations that are being used in those in particular in Spanish and Norwegian and of course English. And we do have other groups we're pulling those together, but they have been tested and used in Italy as well, in Italian. So we do have other statements available in the other languages. And if anyone is interested in translating them to other languages, I think that's fantastic. That would be great. Please contact us.